Physician liberty means the ability to look your patient in the eye and know that you can tell them all the things they need to hear so they can make all the decisions that are in their interest and they can choose what the right treatment is for them. And they don't have to worry that an insurance company is tying my hands and will penalize me if I happen to tell them about the most expensive cancer drug on the horizon.
To me, physician liberty is extremely important because if I have a contract with my patient, I want to be at complete freedom to decide for myself and for my patient, in conjunction with my patient's decision, what is going to be in their best interest.
The patient-centered treatment approach is the one from the Oath of Hippocrates, that I will prescribe for the good of my patients according to the best of my ability and judgment, not according to the protocol, not according to expert guidelines, not according to the bottom line of the third party or the government.
Putting protocols in for physicians to cut costs for health care is just not realistic because medicine doesn't work like that. People aren't cookie cutters. We're not widgets. Doctors aren't automatons, and patients aren't automatons either.
When the government puts together guidelines for best practices, it sounds noble, but unfortunately the government is always years behind. The second problem is that it's a couple of people making the opinion, and frequently they're wrong. We know that if you go back to the recommendations from national bodies 10 years ago, the majority are now considered bad medicine. So if we have a government organization putting together guidelines, they'll be out of date before they're even published.
Physicians need some guidelines to follow, but they don't need to be in the hands of government. They need to be in the hands of specialty societies, so a doctor can use that to supplement their education along the way. What happens when government panels and bureaucrats and insurance company bureaucrats set the standards for quality, quality goes down.
Each patient problem is individualized when it's the patient and the physician making the decisions. As an ophthalmologist, when my vision dropped off from 2015 to 2020, I could no longer do eye surgery. So I needed to have my cataract surgery when I was still 20/20 vision. I could not see through the microscope. So that it was against the rules for me to have cataract surgery. However, without the cataract surgery, I could no longer practice medicine. That is the problem with government-mandated rules.
Probably the best way to control costs is to have the patient pay at least a portion of the care they provide. If the patient gets free care, the demand is unlimited. We ration every day when we go to a store because we know what's in our wallet and what we can afford. If the patient has to pay a portion of the care, not only does that express some degree of value to the patient, to the physician, and some recognition that the physician is providing something of value, it also gives them pause as to what it is they're consuming.
Malpractice costs are calculated to be approximately $126 billion a year in the United States alone out of the $2.4 trillion a year that we spend. If we did not have the malpractice encumbrance, the physicians could actually write a check in the United States and pay for every uninsured patient in the country. That is how much money is being drained out for the attorney's fees and the malpractice costs. The algorithm that Senator Coburn has proposed is to have state courts, 3 attorneys, 3 expert witnesses, and those adjudicate with a judge whether the patient actually suffered a malpractice events, and to pay that patient promptly.
The decision as to how to treat a patient should be made by the patient. A doctor is a consultant. We have knowledge, we assist the patient, we do a history, we do a physical exam, we help them with what's wrong with them. The diagnosis is the key. And once the diagnosis is present, then we can give the patient the various options.
The person who should be deciding how patients are treated is ultimately the patient, with the counsel and advice of the physician of his choice.
It should be the patient and the physician in the office, not the patient and the physician along with an attorney, an insurance representative, and a government bureaucrat.
I'm an independent physician. I have no contracts with insurance companies. I have no contract with Medicare. So I am currently free to treat the patient as my training and experience would dictate I should help them with their medical problem.
In my practice and the relationships that I have with my patients, I am only responsible to them for the care that I render. I don't have to worry about third-party intrusion.
The reason why I'm dropping out of Medicare is that the government initially encouraged us to do procedures in our office facilities. However, over the last several years, they've dramatically decreased what they are willing to pay us. They're doing this in order to limit the amount of procedures that are being performed, which is limiting the access of health care to our patients and limiting our ability to provide good medical services and care. We're essentially being regulated and controlled by the government, and I cannot provide my medical services under those types of conditions.
Patients come to me and pay cash, check, or credit card because they want my 100% attention to their concerns. They have Medicare, they have insurance plans, but they're receiving the care that is dictated by their insurance plan, and they want to know that I'm looking at them as an individual.
Congress needs to create an environment whereby patients and doctors can get the best care. And that really means get out of the way. Give us back our money as far as taxes are concerned, and let people purchase the best health care at the lowest cost.
As doctors, we must take a stand right now because our patients are trusting us to look out for their best interests.
The solution is to empower patients. Patients need to hold the money. Patients need to have decision-making power in their hands, and they need an insurance plan, but a real insurance plan, not one that pays for every sniffle and sprained ankle and back surgery evaluation, but one that pays for a heart attack or cancer, something unexpected. You should use your health insurance a few times in your life, not every time you walk into the doctor's office.
For reforming health care in Congress, as they make the laws, their highest priority should be what helps patients take care of themselves. Everything else should be stripped away.
Physicians must speak up now on the independence of their practices, or they may forever lose the opportunity.
The president likes to say the status quo must change. That's correct. But the status quo has been built up by the government and insurance companies for the last 40 years, and they have caused the problems. Truly changing the status quo will put power in patients' hands, not in the hands of government or insurance companies through mandates and rationing panels. These are things that need to change. Will Congress actually change the status quo, or will they reinforce it?